Hi, I'm Ruth Brignall and I'm the Acting Global Medical Expert at Oxford Immunotech. I'm going to talk to you today about the importance of T-cell testing in SARS-CoV-2 infection and a little bit about the T-spot discovery SARS-CoV-2 research use only test that Oxford Immunotech released earlier this year. Testing for SARS-CoV-2 infection is a really critical part of controlling the virus, and there are currently two main ways to test for SARS-CoV-2 infection. The first is PCR, which allows us to test for current infection with SARS-CoV-2, and the second is antibody testing, which allows us to see if someone has been previously infected with the SARS-CoV-2 virus. Emerging evidence has started to show that both PCR and antibody results are both dependent on specific time points post-infection. And a lot of this is based on some recent reports, including one which is published in the New England Journal of Medicine, that have shown that antibodies may be quite transient in nature and the protective role of antibodies in SARS-CoV-2 infection might be being overestimated. So this study in the New England Journal of Medicine showed that humoral immunity against SARS-CoV-2 might not be that long-lasting in people who suffered from a mild illness, which, as we know, is most people who suffer from COVID-19 disease. And the study also showed that SARS-CoV-2 antibody decay seems to happen at a faster pace than was found for previous human coronaviruses like MERS and SARS-CoV-1. So what all of this is really saying is that the SARS-CoV-2 specific antibody response may be quite transient in nature. So where do T cells come into this? Well, there's accumulating evidence that supports a role for both CD4 and CD8 T cell subsets in COVID-19. And very likely in the immunological memory that forms following recovery from SARS-CoV-2 infection. There's also evidence that SARS-CoV-2 T-cell memory might be more durable than the antibody response. And this goes with what I was saying earlier, that the antibody response may be quite transient in nature. T-cells have also been shown to develop a memory that's very similar to that that's developed in the context of a successful vaccine. And some studies have also shown that T-cell memory might be able to prevent recurrent episodes of severe COVID-19, even in individuals who are seronegative. And what this is really saying is that T-cells might be playing a really important role in viral clearance, immunological memory, and in any potential protective immunity which is built up against SARS-CoV-2. Now, what's really interesting is that some individuals who don't develop an antibody response actually show really strong, really specific T-cell responses. And there were a couple of reasons why we think the T-cell and the antibody response might become uncoupled. The first is that someone might develop a mild infection, and they are able to eliminate this infection using just innate immunity and T-cell responses, and they never actually have to generate an antibody response. And the second is that someone may have developed an antibody response, but it was relatively transient in nature, and it had already declined at the time of testing when the T-cell response was still really strong. And this means that if we use antibodies as the sole marker for whether someone's been infected with SARS-CoV-2, we could be really underestimating the extent of SARS-CoV-2 exposure in the general population. And identifying additional cases that haven't been identified by antibodies is really important, as it improves our chances of being able to detect who has been exposed. So now that I've set the scene, I'm going to change track slightly and talk about the T-spot discovery SARS-CoV-2 research use only kit. So the T-spot discovery SARS-CoV-2 kit uses proven T-cell technology to detect and measure the strength of the T-cell responses to SARS-CoV-2. The kit covers all viral structural proteins and analyzes the response to these structural proteins individually for greater insight. The kit is currently designated research use only, or RUO, but we do intend to file for global regulatory approval as our use cases solidify. So how does the test actually work? Well, it starts with a routine blood draw to get a single vial of whole blood, and then the peripheral blood mononuclear cells, or the PBMCs, are separated out of the whole blood. And this PBMC fraction is roughly 70 to 85% T cells, so it's really enriched for the cells that we want to study. These peripheral blood mononuclear cells are then washed, counted, and then plated into the assay. And this means that it's a really standardized approach for measuring T-cell responses. And this also means that we can provide a really reproducible result. The next step is to add SARS-CoV-2 specific antigens to the cells to challenge the cells and incubate the cells with those antigens. And the idea here is that any cell that's come into contact with SARS-CoV-2 in the past because the person has been exposed to the virus will start to produce interferon gamma in response to these SARS-CoV-2 specific antigens. And that interferon gamma is captured by interferon gamma antibodies on the bottom of the plate. The next step is to add a secondary labeled antibody which binds to the captured interferon gamma on the bottom of the plate. And then finally, a detection reagent is added, which creates a bluey purpley spot wherever interferon gamma has been produced. So what these spots on the bottom of the plate tell us, they're really a footprint of an individual cell which has been producing interferon gamma in response to the SARS-CoV-2 specific antigens. So this is a real single cell resolution and result. So this slide just really shows us what the test looks like for each person who's tested using the T-Spot Discovery SARS-CoV-2 kit. And for each person, there will be 7 panels. There will be a nil control and a positive control for every person tested. The nil control is just cell culture media, and this is just to check that there's not a big non-specific interferon gamma response happening. And the positive control is phytohemagglutinin or PHA. And this is just to check that the cells in the assay are functional and responsive, and they're producing interferon gamma in response to a stimulus. And then there are 5 SARS-CoV-2 specific antigen panels. And these are really the panels that allow us to count the number of SARS-CoV-2 specific T cells out of the 250,000 cells that are put into each well that are responding to the SARS-CoV-2 antigens used in the test. And now I'm going to talk a little bit more about what's actually in these SARS-CoV-2 specific antigen panels. All of the antigens used in the test are based on and span the length of the structural proteins of the novel coronavirus. And the proteins that have been used are the spike protein, nucleocapsid protein, membrane protein, and the envelope protein. And what this means is that we can really investigate the maximum breadth of the immune response to all of the different structural proteins of the novel coronavirus. The peptides in the test are also designed to elicit both CD4 and CD8 T cell responses, and specific sequences that have high homology to endemic or non-SARS-CoV-2 coronaviruses have been removed to increase the specificity of the test. The T-Spot technology is also scalable, meaning that it has manual, semi, and fully automated options. And there are multiple different options for sample stability and regulatory approved accessory kits to help with scaling up production and implementing the T-Spot technology in most laboratories. So how does the T-Spot Discovery SARS-CoV-2 actually work in a clinical or a laboratory setting? Well, most of the results that are ongoing are in the preliminary phase. However, we can share a couple of the main observations from some analysis that's been done so far. We conducted a prospective epidemiological study of 2,500 frontline workers, and this was done to look at serological and T cell responses in people who had reported previous infection. And there were a couple of really great observations that we've been able to make so far. And the first is that the T-Spot Discovery SARS-CoV-2 kit is able to identify large numbers of infected individuals. So the majority of people who reported previous infection generated strong T cell responses that could be detected using the kit. The second thing that we noticed was that the T-Spot Discovery SARS-CoV-2 kit was able to identify individuals who were infected with SARS-CoV-2, but who were missed by antibody testing, so they were serologically negative. And finally, some individuals who were infected with SARS-CoV-2, but who were antibody negative, actually had really strong, really robust T cell responses that were picked up by the T-Spot Discovery kit. And these findings correspond really well with all of the emerging evidence that I discussed at the beginning of this presentation about the importance of T cell testing in SARS-CoV-2 infection. So in summary, I've talked a little bit today about PCR and serology and how the outcomes of these tests are dependent on the time at which the test is conducted post-infection. I've also talked a little bit about the value of antibody testing and how this might be limited in people who don't develop antibody responses or whose antibody responses have declined over time. What I hope I've also shown is that SARS-CoV-2 T cells are produced in the vast majority of infected cases, and that T cells might be the best predictor of long-term vaccine-induced immunity. And finally, I've also discussed the use of multiple different structural proteins in the SARS-CoV-2 discovery test. And this means that we can look at T cell responses to these individual proteins to really look at the maximum breadth of the immune response. So in conclusion, T cell testing is really important as an adjunct to antibody testing in investigating immunity to SARS-CoV-2, particularly if antibody testing is underestimating the amount of people who have been exposed to the virus in the population. The breadth of the immune response is also really important, and this is a huge advantage of the T-Spot Discovery SARS-CoV-2 test, which is able to really look at the individual immune response to structural proteins from the novel coronavirus. Thank you so much for your time today, and I really hope that this was a useful short discussion on the importance of T-cell testing in SARS-CoV-2 infection.